Good afternoon. I am Dr. Sanjita Das. I am working as Professor, Head of the Department, NIT Pharmacy Institute, Greater Noida. So, today I am going to discuss about the medication chart review, clinical review and the pharmacist interventions. So, this medication chart review, clinical review and pharmacist intervention, it is a part of pharmacy practice and it is very much important to know about what are the medication chart review and what are the clinical review and pharmacist interventions. So, let us know one by one and we should elaborate as a pharmacist we should all know about all these aspects. So, what is this medication chart review? Let us know what is medication chart review. It is the fundamental responsibility of a pharmacist, right. It is the fundamental responsibility of a pharmacist to ensure the appropriateness of medication order. What should be the medication order? So, one pharmacist should have the proper and all essential knowledge about the appropriateness of the medication orders. It serves this, that is medication chart review, it serves as starting point for other clinical pharmacy, any other clinical pharmacy activities, medication, counseling, TDM, DI and ADR. Okay. So, these are other activities. So, the prime one is medication chart review. So, it is a fundamental responsibility of a pharmacist to ensure the appropriateness of medication orders. So, it is very much essential for a pharmacist. Organizing information according to the medical problems helps break down a complex situation into individual parts. So, the medication charting involves process such as medical chart audit, organizing of the chart chronographically, right, and that is the checking of any missing information, developing the analysis and the summary of chart and a timeline of everything. It is all together, it summarizes or it comprises of this comprises under the what medication chart review. Okay. So, what are the goals of this medication chart review? Let us know about the goals of medication chart review. To optimize the patient's, okay, to optimize the patient's drug therapy. So, that is the prime and important goal of medication chart review. As the total pharmacy practice, the target is the patient care, here also to optimize the patient drug therapy, it is one goal of medication chart review. Then next is to prevent or minimize drug related problems, any medication error. So, that is to be prevented or to minimize, like any type of that is if there are some drugs in the prescription and the medication and these are found to be interacted, right. There is it has been observed that there are some drug interactions. So, prevent that, to prevent or to minimize the drug related problems or medication errors, it is the second goal of this medication chart review. So, what is the first one? That is to optimize the patient drug therapy and the next one is to prevent and minimize the drug related problems and medication errors. So, these two are the main goals of medication chart error. So, what are the procedure of medication chart error? So, let us know what are the procedures of medication chart error. The patient's medical record should be reviewed in conjunction with the medication administration record. Always these two should be observed and should be monitored and reviewed in conjugation, right. And recent consultation, treatment plan and daily process, daily any progress is going on, daily progress should be monitored when determining the appropriateness of medication orders and planning each patient's care. Because I think it is totally in pharmacy practice we know that each patient has different medication history and different medication chart, right. And so, the individualized the chart, recent consultations, treatment plans, right, and the daily progress should be monitored when determining the appropriateness of the medication orders. And any planning that is each patient's care, planning of each patient care, right. So, all current and recent medication orders should be reviewed properly. What are the there is medications, what are the there is current medications, recent medications, what are the orders, everything should be reviewed properly. So, all these are coming under the procedures of medication chart review. Then next is about the components of medication chart review. So, let us know what are the different components of medication chart review. First thing is checking that medication order, right, is written in accordance with the legal and local requirements. It is very much essential. The checking that medication order is whether it is written in accordance to the legal and local requirements. And next thing, next component is ensuring that the medication order is comprehensive and unambiguous. Okay? We have to ensure that the medication order is comprehensive and unambiguous, that appropriate terminology is used and that drug name are not abbreviated. Okay? Drug names should be incomplete, it should not be abbreviated in that chart, right, medication chart. And another thing is there, that is annotate the chart to provide clarification as required. So, total clarification must be there. And next thing is detecting orders for medication, right, to which the patient may be hypersensitivity or any type of intolerance is there. So, we have to detect the orders for medication to which the patient, the individual patient may be hypersensitive, okay, or may be intolerant. That means, there is some hypersensitivity reaction to the patient due to that medication. So, that is the thing to be detected, right. So, next thing is that ensuring that medication order is appropriate with respect to the patient's previous medication order, right, the patient's specific considerations, for example, disease state, pregnancy, that thing any patient, individual patient, we have to consider its specific case, whether there is any disease state, whether there is, if the patient is with some hepatotoxicity or renal toxicity, then the medication, it will affect the medication, the drug adverse effect will be different, right. And if it is pregnancy, then the that case should be considered. Okay. The medication order has to be checked if the condition of the patient is, she is pregnant, right. Then drug dose and dosage schedule, especially with respect to any other is function or liver function, mainly renal function, we have to be very much strict. As I told you just now, disease state, in disease state, if there is any renal disease, then the effect will be different, the drug toxicity will be different, right. So, the drug dose and dosage schedule, especially with respect to the renal function and liver function, has to be considered, right. Then which route it is there, and we have to review that, the route, the dosage form and the method of administration. All these things are the coming under the components of medication chart review. Along with the rest thing are, that is the checking complete drug profile for medication duplication, interactions of incompatibilities we have to check, during the medication chart review, and ensuring that administration times are appropriate, for example, with respect to food, other drugs and procedures, right. Then next thing is checking the medication administration record to ensure that all orders have been administered. The next thing is that ensuring that the drug administration order clearly indicates the time at which drug administration is to be commenced. At what time the drug administration is to be commenced, before the that is a meal, or before going to bed, or just before taking the breakfast in empty stomach. What is the time of administration, that has to be ensured, right. Then special considerations should be given, especially in short course therapy, as in case of antibiotics and analgesics. It is very much essential for special considerations for these, right. Then next is ensuring that the order is cancelled in all sections of medication administration's record when the drug therapy is intended to cease. It should be cancelled in everywhere, right. So next is about the components. What are the components of medication chart review? Let us know about the components. If appropriate follow up of any non-formulary drug orders, that is recommending a formulary equivalent if required. The next is ensuring appropriate therapy monitoring is implemented. So next component of medication chart error is ensuring that all necessary medication is ordered. Whatever the medication error, that should be medication, that is anything is there, that should be properly ordered, right. So we have to ensure all necessary medication is ordered. Then for example, like pre-medication, prophylaxis, if anything is there, that should be properly ordered. And reviewing medication for cost effectiveness, right, reviewing the total medication for cost effectiveness. And next is identification of the drug related problems. So it is very much interesting. What are the components for this medication chart review? All these are components. So under the identification of drug related problems, what are the things? There is untreated indication, inappropriate drug selection, any adverse drug reaction, or failure to receive the drug. So all these are coming under the identification of drug related problems. So these are different components of medication chart review. Then medication chart endorsement. So another important goal of treatment chart review is to minimize the risk of medication error, right, that might occur, that error, that medication error might occur at the level of prescribing and or drug administration. It may be there at any step, right. So it should be minimized. The medication error is any preventable error. It is one preventable error that may lead to inappropriate medication use or patient harm. Always we should remember that the medication error is any preventable error that may lead to inappropriate medication use or patient harm, right. So we have to minimize that. Then to prevent potential morbidity and mortality associated with these errors, pharmacist should systematically review the medication chart and write annotations on the chart where the medication orders are unclear. So all these things are very much essential for this medication chart review. Then what is clinical review? Clinical review is one of the integral component of medication review and should preferably be performed on a daily basis. And it is the review of the patient's progress for the purpose of assessing the therapeutic outcome. And the therapeutic goal for the specific disease should be clearly identified before the review. So all these clinical review, it is coming under that particular medication review, and it is one you may say it is one integral component of this medication review, and it should be done regularly. That means, daily basis it should be done, and it is mainly it is for the patient progress. What is the progress of the patients? It should be monitored properly. The therapeutic goal, what is the therapeutic goal of that particular patient, individual patient, it has to be assessed, and for specific disease should be clearly identified before the review. So, what are the goals of this clinical review? Let us know. The primary aims of the clinical review are to assess the response of the drug treatment, right. What is the main target? What is the main aim of this clinical review? That is for the drug treatment, and we have to assess the response to that particular drug treatment, how much the patient is responding to the drug treatment. Then evaluate the safety of the treatment regimen. We have to, along with that, we have to evaluate the safety of the treatment regimen. And next is assessing the progress of the disease and the need for any range, if there is any kind of change in the therapy during the treatment procedure, we have to assess the progress of the disease, right, and the need for any change in therapy. If the patient is taking any one medications, is there any need to change the medication, or is there any need to add some other medication? If he or she for diabetes, it is taking some that is medications like sulfonylureas, is there any need to add any other agent like if it is not properly cured and progress of disease is also there, then we have to add insulin or like this. So, assess the need for monitoring, if any. Assess the convenience of therapy to improve the compliance. So, the next is about the drug use evaluation. This drug use evaluation is an ongoing process, authorized and systematic quality improvement process. This whole process is one quality improvement process. The drug use evaluation is an ongoing process, authorized and systematic quality improvement process. So, this is about the drug use evaluation. So, it is mainly designed to review the drug use and or prescribing patterns. And next is, it is also designed to provide feedback of results to clinicians and other relevant groups. And this drug use evaluation, it is also designed to develop the mainly the criteria and standards. What are the standards? What are the criteria? All these can be developed by this drug use evaluation. Okay. So, this drug use evaluation, it is also to promote the appropriate drug use. So, all these four are coming under drug use evaluation. One is review drug use and or the prescribing patterns, and it is also designed to provide feedback of results to clinicians and other relevant groups, develop criteria and standards, and to promote the appropriate drug use. So, these are that is different types of drug use evaluation. One is quantitative drug use evaluation studies and another one is qualitative drug use evaluation studies. In case of quantitative, that is we are going to, we are mainly analyzing the effectiveness, that is measuring the effectiveness, and in case of qualitative we are estimating, and that is what is the drug use evaluation. Okay. And we are evaluating or estimating, right. So, different steps involved in drug use evaluation are: step 1, that is identify drugs and therapeutic areas of practice for possible inclusion in the program, and next step is designing of study, and the third step is define criteria and standards. The next step is design the data collection form, and the sixth step is evaluating the results. And the last step is, that is the data collection, for which we are doing all this, and we will collect the data and we will evaluate. Then all these are some additional steps to the previous one, that is to identify the drug therapeutic areas, then the designing of study, define the criteria, designing the data collection form, then we have to evaluate the result, then we have now collected the data. Okay. Then next step is evaluate the results, right, then provide feedback of the result. Then the eighth step is develop and implement interventions. Then the ninth step is re-evaluate to determine if the drug use has improved or not. We have to re-evaluate, right, and reassess and revise the drug use evaluation program. We have to go for reassessing and revising the drug use evaluation program, and then we have to go for the feedback results. The next is, what is the role of pharmacist? As we are pharmacist, what is the role of pharmacist in drug use evaluation? Let us know. The program development, supervision and coordination is the prime role of pharmacist in drug use evaluation. The next is education of hospital staff, right, and promotion of the goals and objectives. This is the third role of pharmacist in drug use evaluation. The next is development and review of audit criteria, right, and development of data collection instruments. So, all these are different roles of pharmacist in drug evaluation process. Then the pharmacist's interventions. What is this? The pharmacist interventions, let us know. Pharmacist intervention and comments written on the prescription, right. They will give the comment on the prescription, where used to revise each error of, mainly by advocating the proper use of medication. This is the main purpose, the proper use of medication, right. So, pharmacist interventions and comments written on the prescriptions were used to revise each error by advocating the proper use of medication. So, the intervention done by the pharmacist can be active or passive or reactive, right, and the decisions are made regarding inpatient management during and round, and the clinical pharmacists participating on ward round may influence these decisions, all these things are influenced. So, decisions are made regarding the inpatient management during ward round, right, when the there is pharmacist, clinical pharmacist with physicians go for ward round, during that the decisions will be made by the clinical pharmacist, and the clinical pharmacist participating on ward rounds, right, may influence these decisions. Okay. So, different aspects of pharmacist's interventions. What are the different aspects? Decreasing healthcare cost and utilization, medication adherence, there must be medication adherence, it is one aspect, and the patient education, right, the effective communication and establishing patient relationship, then medication therapy management, and as a member of healthcare team, it is essential for the pharmacist. Okay. So, these are different aspects of pharmacist intervention. First is decreasing healthcare cost and utilization, first thing. Medication adherence, the patient should have the medicines or the there is any type of agent which is given to the patient should be at proper time and proper use, right, and patient education. It is also one part of this pharmacist intervention, right. And next is effective communication and establishing patient relationship. It is one part of, one aspect of pharmacist intervention. And next is medication therapy management. It is next aspect of the pharmacist in intervention. The medication therapy management, it is very much essential for the betterment of the patient, for the better efficacy of the that is treatment procedure, right. And as a member of healthcare team, it is one there is prior role of this pharmacist for pharmacist that is taking care of all these things. So, we all came to conclusion that the pharmacist, the clinical pharmacist is playing important role in all these aspects of medication review and all these betterment of patient care by proper patient communication, proper patient relationship, by which the pharmacist interventions are taken into consideration. The pharmacist intervention during the, as I told you, during the, it may be during the ward round, it may be during the that is discussion with the patient. So, if there is any kind of errors will be found during total discussion, so it has to be mentioned, and these things has to be considered for the any error will be there in the medication, that has to be considered properly, and it has to be implicated also. And this is the importance of clinical pharmacist in the patient care. So, all these aspects are very much essential in pharmacy practice, and we should we cannot that is ignore all these things, and we have to take care of the drug interactions, the adverse reactions, the patient care, that is any kind of adverse reactions which are unexpected adverse reactions which may occur during the medications. If the patient will come to the clinical pharmacy and during the that is ward round, if the clinical pharmacist will come to know about any kind of that is review of all these medication history and or the medication that is chart, and he or she will come to know about any kind of error, it has to be notified and it has to be that is taken into consideration. So, it is all about this that is pharmacy interventions and DUIE, all these are all about these things. Thank you so much.